PA Day is very important to all PAs and recognizes the day, October 6, 1967, when the first class of physician assistants graduated from Duke University. I'm grateful for physicians like Dr. Eugene Stead and Dr. Harvey Estes, who were visionaries and recognized a need that the physician assistant profession could fill at a time when it was not clear whether there would be enough general practitioners to provide health care for all Americans. I plan to celebrate PA Week by traveling to Chicago, where I will be speaking at the Illinois Academy of Physician Assistants meeting on Saturday of that week. It's important this year that we keep in mind the healthcare reform movement currently underway in Congress. It's important to use PA Week and the heightened attention that we receive from this week to enhance our advocacy efforts. I encourage every PA to be proud of what you do and not hesitate to let your patients, your physicians, and your legislators know. I encourage every PA to use PA Week to go to aapa.org to the advocacy page, click on Capital Whiz, and write or call your legislators. Use the materials to let your patients know how important PAs are to the healthcare system. Let your physician colleagues know how important PAs are to the care that they deliver. I think if we all work together, I think we can achieve a lot of our goals with healthcare reform and continue to work on improved legislation at the state and national level. Since I became AAPA president, I've had the privilege and honor of representing the profession across the United States. I've done white coat ceremonies to welcome our newest colleagues into the profession. I just returned from New Mexico, where I spoke at the New Mexico Academy of Physician Assistants annual meetings. I always enjoy meeting with students and seeing their enthusiasm for becoming PAs and meeting with my fellow colleagues who are always enthusiastic about the patient care that they deliver. I look forward to traveling across the United States in the coming months, and I hope to get the opportunity to meet each and every one of you. I'm very optimistic with the healthcare reform legislation currently in front of Congress. Your AAPA staff, as well as leaders, and many of you who have responded to our calls for advocacy efforts, have ensured that PAs are recognized in the legislation and that barriers to physician PA practice are being eliminated in the draft legislation. We have to continue to work hard to make sure that those changes remain in the bills and that what ultimately reaches the President's desk for signature is good for our patients and good for physician PA practice. I believe that PAs need to start preparing for the post-healthcare reform environment, and I think they're going to be happy with what they find when they get there. Our inclusion in chronic medical management and the medical home will be important in the legislation. I believe that there'll be funding for PA education at present or higher levels to make sure that we have adequate numbers of PAs and other healthcare providers to deliver needed healthcare in the new environment. So I remain optimistic. I think that we will continue to make sure that the changes that are in the bills now stay in the bills, and we'll continue to identify opportunities to improve the healthcare of Americans wherever we can. It has been an honor being your president, and I look forward to representing you in the coming months.